Analgesics. Okay, previously as we can discuss that opioid analgesics in detail. So today we can go to this called as Nsaids entire classification, non-steroidal anti-inflammatory drugs. Okay, part of analgesics. So in this opioid analgesics we can pin in the comment box. Okay, you can search their opioid analgesics. So now we can discuss the entire classification of non-steroidal anti-inflammatory drugs. Okay, the analgesics means once I will recalling that these are the agents, these are the drugs which selectively reduces the pain by acting on the central nervous system and peripheral pain mechanism. Okay, without altering the consciousness of person is called analgesics. Mainly classified into opioid analgesics and non-steroidal anti-inflammatory drugs. Opioid analgesics is also known as narcotic analgesics, which is a derivative form of the plant that is called as papaver somniferum. So today we can discuss the entire classification of NSAIDs. See, in this non-steroidal anti-inflammatory drugs, we can move on to the first. It is mainly classified into 1, 2, 3, 4. There are 4 main classifications here we can classify. The first one is here, non-selective COX inhibitors. I will say what is meant by COX. Okay, this is a cyclooxygenase. I will tell you the mechanism of action of this NSAIDs. We can see that non-selective cyclooxygenase inhibitors. That is first. Then second one is preferential COX-2 inhibitors. Then third one is selective COX-2 inhibitors, cyclooxygenase 2 inhibitors. Then fourth one is analgesic aligned with antibiotic with poor anti-inflammatory action. Here main stress point here is there is a high analgesic will be there and anti-inflammatory will be there, but antibiotic will be there, but there is a poor anti-inflammatory action will be there. Okay, that is the main 4 main classification of this non-steroidal anti-inflammatory drug without the steroid. See, first come to the point of view non-selective cyclooxygenase inhibitors. In that, first one is salicylate. Very important. This is salicylate. Example called aspirin. Most wide effective use of this aspirin in the hospital sector. Then second one is proionic acid. Proionic acid derivative forms. Examples ibuprofen, naproxen and ketoprofen. All are with ends with the profen. Ibuprofen, naproxen and ketoprofen. Okay, these are the main 3 examples of proionic acid. Next, phenamate derivatives. Example, mefenamic acid, that is also known as meftal plus, which is used to treat the muscle cramps, the stomach muscle cramps. In that condition, we can give this mefenamic acid. It is not related to GA system. It is comes under the non-steroidal anti-inflammatory drug, also known as meftal plus. Then enolic derivatives. Example, piroxicam and tenoxicam. These are the 2 examples comes under enolic derivative acids. Then acetic acid derivatives. Example, indomethacin. This drug which is used to in also to treat the congenital anomalies which is present in the newborns, such as for example patent ductal arteriosus. For that cases we can use this indomethacin is a major drug for the drug choice of that type of PDS cases. And then pyrazinol derivatives. Example, phenylbutazone and oxyphenbutazone. These are the 2 examples comes under this pyrazinol derivatives. These are comes under non-selective cyclooxygenase. COX means cyclooxygenase inhibitor. This is a very most important classification of drug. And then we move on to the preferential COX-2 inhibitors. Preferential cyclooxygenase 2 inhibitors. Example, nimesulide. If the patient is suspecting with a more headache and along with their antipyretic, if there is any fever also, that prescribed that is a nimesulide. Then diclofenac, more familiar drug. Aceclofenac. See, the difference between diclo and aceclo is the aceclofenac is having the more side effects than is less side effects than compared to the diclofenac. Okay, so the most of the doctors have prescribed this aceclofenac as an analgesic agent for the all cases. Okay, this is as because of this less side effects compared to diclofenac. Then meloxicam. This is the 4 examples comes under the preferential COX-2 inhibitors. Next, come to the selective COX-2 inhibitors. The selective COX-2 inhibitors example, this is less use of drugs. The example celecoxib and paracoxib. These are the two examples of selective COX-2 inhibitors. Then most important classification, that is called fourth one, that is called analgesics along with antibiotic action. With poor anti-inflammatory, it will reduce the pain along with fever, but less swelling, tenderness, and if any related to the inflammatory regions. That has to be poor action. Example of that is called para-aminophenol. Example PCT, paracetamol and acetaminophen. It is useful to treat the hyperpiracia, and acetaminophen it is used to the anti-inflammatory drugs such as arthritis, joint related pains. So that conditions we can use this acetaminophen. If there is a severe hyperpiracia more than the normal level, they can resist this acetaminophen also. Then pyrazonol, example metimazole and propionazole is the example of this pyrazonol. Next, benzoxazocaine derivatives, example nefopam. These are the examples comes under this analgesics with antipyretic. The most usable drugs are here in this classification is this BCT and acetaminophen. These are the very useful drugs comes under analgesics and antipyretic actions. This is the entire classification of this NSAIDs. If they ask classify analgesics, you write both that opioid analgesics and NSAIDs classification, right? If they ask morphine, you have to write what the previous class we have said. And if they ask to ask this aspirin, they ask next classify analgesics and explain any one of NSAIDs drugs. Like that they ask, we have to write this aspirin. This is one of the taking example of this NSAIDs classification. Okay, so we have to discuss about the entire mechanism of action of this NSAIDs. I will take one example here, that is example salicylates. First one is that is aspirin. Aspirin comes under what? Non-selective cyclooxygenase inhibitors. You have to write the pharmacology of aspirin. Related to introduction, you have to write pharmacology of this aspirin. What you have to write here means this is comes under non-selective cyclooxygenase inhibitors. First point, and then it is comes under salicylates. Then it will convert in our body acetic acid into the salicylic acid. Acetic acid into the salicylate acid. Okay, these are the three main points comes under this pharmacology of aspirin. Non-selective COX inhibitors, salicylates, this comes under salicylates. It will rapidly convert in our body acetic acid into the salicylic acid. So that's why we can call this comes under this salicylates. Okay, this is pharmacology of this aspirin. And then main, that is called as mechanism of action. Mechanism of action of this NSAIDs or aspirin. First, what happens? There are the two enzymes, that is called as cyclooxygenase 1 and cyclooxygenase 2. What we can discuss in what enter the classification. What? COX-1 and COX-2. These are the two enzymes, cyclooxygenase 1 and cyclooxygenase 2. These are the main two enzymes which will, what the purpose of these enzymes means, it will helpful for the synthesis of the prostaglandins. The functions of the prostaglandins is stimulating the pain. So what happens, this cyclooxygenase 1 and cyclooxygenase 2, which will helpful for the synthesis of the prostaglandins. So what happens, this the NSAIDs drugs, it will go and block this both cyclooxygenase 1 and cyclooxygenase 2. Okay, that will lead to what? It will reduce the pain. Okay, simple mechanism of action. There is a two enzymes, that is called cyclooxygenase 1 and cyclooxygenase 2, which will helpful for the synthesis of the prostaglandins. So while giving this NSAIDs drug, example aspirin, it will go and bind this, block this both cyclooxygenase 1 and cyclooxygenase 2. That will lead to there is a reduce the prostaglandin synthesis. Okay, here there will be a reduce the prostaglandin synthesis. that leads to reduces the pain. Okay, this is simple mechanism of action of this aspirin. So that's why I mentioned there will be a, this is the mechanism of action of this aspirin comes under the NSAIDs. Now we move on to the main pharmacological action of this aspirin. Of aspirin. First one is that is called analgesic. Second one is antipyretic, anti-inflammatory, on GIT, and also along with the GI system CVS and urate excretion. Yes. What happens in pharmacological action of this aspirin? The first one is analgesics. What happens during the inflammation or during the any inflammation region or during the illnesses, during the injuries? What happens? There is a cause of severe pain. So it will go and act on the prostaglandins. It will block the prostaglandins. It will reduces the synthesis of the prostaglandin and it will releases the pain. That is the main as the act of the analgesics. First one is it will go and act on the prostaglandins and reduces the pain. First one is antipyretic. Okay, the inflammatory region which is caused by the fever. The inflammatory region which is caused by the pain. The inflammatory region which is caused by the fever, that will go to the acting on the temperature regulating system and it will reduces the what? Fever. That is called antipyretic action. Examples PCT and acetaminophen. These are two examples of this antipyretic. And then anti-inflammatory. Already we know that this comes under, there is a antipyretic and analgesics along with the poor anti-inflammatory effect. So one of the main uses of this is called anti-inflammatory. Example we can give this anti-inflammatory. This is called acetaminophen. Okay, this is a very useful drug which is used to treat the inflammation such as pain, swelling, tenderness and erythema related to the skin. Okay, these are the main four conditions we treat under this anti-inflammatory effect. Then GI is very important. What happens here? This NSAID drug, example aspirin, it will go and blocks or inhibits the prostaglandins which is present in the gastric mucosa. Okay, it will inhibit. So what happens in GI system? It will inhibit the prostaglandins which is present in the gastric mucosa. What happens? Then there will be a loss of protective function. Of that GI mucosa, and that leads to what happens? There will be increasing the HCl production. When the loss of protective function of that gastric mucosa, increasing the HCl, hydrochloric acid will be increased. That leads to what happens? Gastric irritation and peptic ulcer. Okay, this is the acting of this NSAID. The adverse effect of the NSAID is taking, this is called gastric irritation and peptic ulcer. Is due to what? There is an intake of this more amount of overdose of this NSAID. Example aspirin. It will inhibit the prostaglandins which is present in the gastric mucosa. Loss of protective function leads to increasing HCl production. What happens? That will leads to gastric irritation and peptic ulcer. This is main on the GIT. Like cardiovascular system. In cardiovascular system, what happens? If there is a overdose of this NSAID drugs, it will leads to what happens? There will be a CCF, means congestive cardiac failure. How means? It will cause the sodium and water retention. Okay, there is intake of more this aspirin or NSAIDs. It will there will be increasing the retention of sodium and water in the body, leads to the CCF, that is congestive cardiac failure. There will be chances. That is on the CVS. Okay, there will be a retention of sodium and water. Then urate excretion. what happens, this in NSAIDs, it will the intake of this aspirin leads to there will be increasing the plasma level of this urate. There is increasing plasma level of the urate due to the retention of the urate in their tubules. Okay, that leads to urate. That is the main function of this urate excretion. This is the main pharmacological action of aspirin is analgesics, antipyretics, inflammatory, GIT, CVS and urate excretion. Okay, it will reduces the excretion of urate in the urine. Okay, that leads to what? This increasing the plasma level of the urate. This is the main function, and also along with this will be acid base balance also will be the function of this aspirin. These are the main pharmacological action. Then we move on to the therapeutic uses. Therapeutic uses will be the same. Analgesics, antipyretics, anti-inflammatory is the common points. Along with there will be a this cancer of the colon polyps. Fourth one, cancer of the colon. Colon polyps. And antipyretic, analgesics, anti-inflammatory is the common point. Along with prevention of colon cancer. Okay, cancer of the colon polyps and then also local use. How local use means that diclofenac what this will comes under the form of injection, tablets along with gel in order to pain relief, in order to reduce the selectively pain. So that's why local use. That is example diclofenac gel here. Are also known as salicylates, and then act as a thrombolytic. These are the main therapeutic uses of this NSAIDs. Then final one is that is called as adverse drug reactions or side effects. Main is this called hepatotoxicity. Hepatotoxicity by due to what means due to the paracetamol. That is the chemical structure of the paracetamol leads to the hepatotoxicity. Then hypersensitivity reaction. Then Ray's syndrome. What happens here in this Ray's syndrome? This is related to the child. Okay, pediatric diseases. What happens here? There will be a damage of the liver with infiltration of fatty liver. Okay, damage of the liver and infiltration of this fatty along with the encephalopathy is called Ray's syndrome. What happens? There is hepatic damage will be there and fatty liver, and along with that there is encephalopathy. These are the three main conditions comes under this Ray's syndrome. This is caused by due to the more uses of NSAIDs, example aspirin. And then along with that electrolyte imbalances, tubular damage. Tubular damage due to what? Because of the retention of urate in the renal tubules. So that's why there will be tubular damage. And electrolyte imbalances. And then final one is CNS toxicity. CNS toxicity leads to drowsiness, calm, and finally leads to, and also along with tinnitus, dizziness and vertigo. Dizziness, tinnitus and vertigo. These are the main causes of this CNS toxicity. Okay, finally that is called hepatotoxicity. That is due to the paracetamol usage, hypersensitivity reactions, Ray's syndrome due to this is damage of the liver, infiltration of fatty liver, and along with the encephalopathy is called Ray's syndrome. Tubular damage related to due to the presence of this urate, and along with the CNS toxicity, and final one that is called as electrolyte imbalance. These are the main consideration of the adverse effects. So today we can discuss about analgesics. In that opioid analgesics already we can discuss. Today we can entirely discuss about this non-steroidal anti-inflammatory drugs. NSAIDs drugs, entire classification we can discuss here. This is the entire classification of this total non-steroidal anti-inflammatory drugs. Main four types: non-selective, preferential, selective, and analgesics and antipyretic with poor action of inflammatory. These are the main classification. The important drug we have to see here is this nimesulide, diclofenac, aceclofenac, aspirin, ibuprofen, naproxen, and mefenamic acid, indomethacin, and nefopam. These are the main what we can tablets or drugs we can see here. Okay, and also PCT and acetaminophen. These are the main drugs we can see in the clinical side. And then we can see the mechanism of action of this aspirin. Then pharmacological action on this analgesics, antipyretic, anti-inflammatory, and GAT and CVS and urate excretion. And then therapeutic uses also similar to that pharmacological action along with local use. And adverse drug reactions, the main stress point here is Reye's syndrome, tubular damage related to the urate, presence of urate in the venous tubules, electrolyte imbalance, and CNS toxicity. Okay, this is about all this class, and next we can discuss about that skeletal muscle relaxants. Thank you.